Most people who've never tried telehealth have the same question. Is this actually going to feel like real medical care? The answer is yes, and once you know what to expect, the whole thing makes a lot more sense. Here's how a SendClinic visit actually works, from the moment you decide to book all the way through getting your treatment. It starts online. You go to SendClinic.com, choose the type of care you need, and fill out a short intake form. That form covers your symptoms, your medical history, your current medications, and any allergies. This isn't just paperwork for paperwork's sake. It gives your provider a clear picture of your situation before the visit even begins. That means less time explaining the basics and more time actually getting help. You also pick your appointment time when you book. No waiting on hold. No showing up and sitting in a waiting room. Just choose a time that works for you and pay online. When your appointment starts, you click a secure link to join the visit by video or phone. A licensed provider greets you, confirms your details, and asks follow-up questions to make sure they fully understand what's going on. From there, they'll walk you through a diagnosis or a plan of care. And if treatment is appropriate, they can send a prescription directly to your local pharmacy, issue a work or school note, or recommend lab testing. Everything goes electronically. No printing, no faxing. The whole visit typically runs about 10 to 15 minutes. That's not a rushed experience. That's an efficient one. Providers are focused, the intake form has already done the groundwork, and you're not waiting behind anyone else. A few things worth knowing. SendClinic uses technology that meets HIPAA standards. That's the federal law governing healthcare privacy in the United States. Your information stays private and secure. And telehealth through SendClinic works whether you're at home, at work, or traveling. Now, there are limits to what telehealth can do, and a good provider will always be upfront about that. If your situation requires a hands-on physical exam, imaging, or in-person testing, your provider will tell you and point you in the right direction. Telehealth is a powerful tool, but it works best when it's the right tool for the job. If you're ever experiencing a medical emergency, chest pain, difficulty breathing, severe injury, or anything that feels urgent and serious, call 911 or get to the nearest emergency room. Telehealth is not the right option in those moments. For everything else, urgent care needs, men's health concerns, STD testing, or a simple doctor's note, the process is straightforward, it's handled by licensed providers, and it doesn't require you to rearrange your day. You can check current availability and get started at SendClinic.com. Talk to your own provider if you have questions about whether telehealth is appropriate for your specific situation. That's always the right first step.